And Ontario has now moved a new group into the highest risk category of their vaccine rollout. So anyone who is pregnant in this province is now eligible for a COVID-19 shot. The move comes after doctors raised major concerns about the number of pregnant patients they were admitting to ICUs.
Knowing that there's a bit of I guess I would say like a light at the end of the tunnel in terms of thinking about your protection and the protection for your baby during COVID it's just such a relief.
Relief after what has felt like a long wait. Anna Milner is 26 weeks pregnant with her first child. It has been a roller coaster of emotions navigating pregnancy during this third wave.
Seeing the case counts go up continuously over the last few weeks has been really, really stressful.
Especially in recent weeks as hospitals in Ontario report an alarming number of pregnant patients in COVID-19 ICUs, a significant increase from the first two waves of the pandemic.
Throughout this year, throughout the pandemic, we weren't seeing that. So in the province in Ontario, we were seeing about 13 pregnant women who ended up in the ICU. But now in a span of just 2 weeks, we were seeing over 13, close to 20, perhaps even more. We don't have the exact numbers yet. So that's way higher than at any other point during the pandemic. But what was striking about some of these pregnant people that have been admitted to hospital is that they didn't have any underlying medical conditions.
So the province now making it official, the option for pregnant people to book an appointment already available on the province's vaccine portal.
It just makes sense. It's the ethical thing to do as well. Like we have a moral obligation. Like no one said you have to get vaccinated, but I know that many pregnant individuals will choose to be vaccinated, and now they can choose to be vaccinated and have priority access.
Advocacy groups have been pushing the province to make this move since January, when it was first noted that pregnant women were especially susceptible to the variants of concern.
Do you think this move should have been made sooner?
We would have liked for it to have been made sooner. And that's why we started advocating more aggressively last week.
If everything had rolled out the way potentially it had intended to, maybe we wouldn't be where we're at today.
As for Anna, she didn't wait a moment longer to book.
And already booked an appointment, so I'm good to go and looking forward to getting that done with.
Amazing. When's it booked for?
May 6th.
As for when would be the best time to get the shot, doctors tell us any point during the pregnancy, whether it's first, second, or third trimester, is a good time to get it. And it is the best shield to protect you and your baby. But of course, if you have any hesitancy, you're encouraged to speak with your healthcare provider.